Hello, I'm Dori Nando. You can catch up with all the fun on the Cosmopolitan Mix and on all our shows via podcast. Just go to My Joy Online podcast and search for your favorite show and relive those moments all over again. Only on Joy 99.7 FM, radio for discerning listeners.
Super Hits Radio, Joy 99.7.
You're watching the AM show. The next conversation we're going to be having, it has to do with COVID-19 and the
Vaccinations.
the vaccinations. It looks like we have Dr. Amponsa-Achiano already joining us, and so let's get straight into the conversation. So thank you very much, Dr. Amponsa-Achiano. We want to find out what the situation is with the rollout of the AstraZeneca vaccines. What's the plan?
Yes, good morning to you, Israel, and good morning to your cherished viewers and listeners alike. Yes, so you will recall that we started COVID-19 vaccination somewhere in March, from 1st March, technically from 2nd March, after His Excellency the President launched the start of the program on the 1st of March. So we started with AstraZeneca vaccine. We, along the line, got a few thousands of doses of Sputnik V. And then quite recently, we got some Johnson & Johnson vaccines. For AstraZeneca, we've done approximately 850,000 persons, of whom a little over half have already received their second dose around somewhere in May. So we now have taken delivery of approximately 250,000 doses of AstraZeneca, and we want to continue with the second doses for those who have been waiting. So we have approximately 400,000 plus persons waiting for the second dose. So the plan is, once you get a vaccine and you look at the population, you definitely have to do a kind of equitable distribution, because the vaccines will not be enough to cover everybody at the same time. So what we've done is we've done some kind of sharing for all regions to benefit based on the data that we have. And so we've distributed our vaccines to all the 16 regions for those who have been waiting for the second dose. So that's the plan. And we're starting this week, today, to be precise.
Right, Dr. Achiano, you talk about equitable distribution of the vaccines, and you talk about data that's available to you based on which you shared these vaccines. Would you care to just walk us through the process or the thought process, that went into deciding how many vaccines each number of region got?
Yeah, so what we did was, first of all, you look at those that are most vulnerable. And in our case, it's the health workers. And of course, if you recall, when we first started, we also spoke of the elderly and the people with underlying conditions. So they were first taken care of when we started the vaccination exercise. And for every region, you had some number of persons within this category. So we share the vaccines first to cover some proportions of health workers and also some proportions of the general population with respect to those who are most vulnerable. And they were the ones who received the vaccines earlier on. You would also recall that when we started the second dose in May, we targeted persons who had received the vaccines from the 1st of March to the 9th of March. So it stands to reason that we just have to continue from the 10th of March. And looking at the data, when we end on the 29th, we would have dished out all the vaccines. And therefore, there'll still be some almost 200,000 people who would have to get the second shot once we get vaccines next week, maximum within the next 2 weeks. We still have some vaccines in the pipeline, AstraZeneca vaccines, and even other vaccines like Moderna, Pfizer, and Johnson & Johnson. But for the purpose of this discussion, I'll say that we are expecting 350,000 doses of AstraZeneca to be delivered to us within this week or next week, and then we can restart the second dose and complete it by the middle of September.
Okay. Are you at any point going to begin to focus on maybe the hotspots that have come up over the past few weeks? So, for example, Bono East was a hotspot a few weeks ago. At the moment, the Bono region is a hotspot. We know that the numbers have gone up. They've recorded more deaths. Is there going to be any sort of focus on the areas that are popping up as hotspots?
Well, I think that the conversation is on second dose. You don't start a second dose when the person hasn't received a first dose.
Well, it's not just on second dose, because you talk about Moderna, you talk about Pfizer, you talk about the Johnson & Johnson. So whilst we're having the second dose conversation, which you have very aptly talked about, and we have totally understood that by the end of September, you would have finished the distribution of second doses, and they'll be left with about 200,000, and we're expecting 1.5 million doses coming from Germany as well. So we know that we have enough.
I haven't mentioned that yet.
No, I know you haven't. I'm telling you what's in the papers.
No, let me tell you what I know. So maybe you can put across what you know later. What I know is that we have 350,000 doses of AstraZeneca that we as Ghana Health Service Ministry of Health been expecting. This would be delivered to us within the week or the next week, 350,000. This 350,000, 250,000 is coming from within COVAX, and then another almost 100,000 coming from Norway, also via COVAX. That's what I'm talking about in terms of the second dose.
Okay.
So let me put that in clear before we add anything. When we get additional vaccines like Moderna, Pfizer, Johnson & Johnson, which we are also expecting within the next couple of weeks, we'll definitely focus on the other areas as well. But remember, Greater Accra, Greater Kumasi or Ashanti for that matter, are still hotspots.
Okay.
The other emerging hotspots, obviously, will take care of that as well. And of course, you have Western, you have Central, you have Eastern, all being hotspots over the past few months.
Okay.
And so we'll still do equitable distribution, looking at geographic and population segmentation in terms of hotspots and vulnerables. Over.
All right, Dr. Achiano, got that. Thank you for that. Israel.
Yes, Dr. Achiano. So let's focus on the people who are anticipating their second doses. What do you tell them, the people who are watching us right now, who are waiting for, or who have been waiting for their second dose for a while? What do you tell them?
Sure. So first of all, we have to reassure people that when you get the first dose, irrespective of the time interval, you will not restart. I think that's what people are apprehensive about. You will still continue with the second dose. It's a general principle in vaccinology or vaccines for that matter. You don't restart. The body will still recognize that you had taken some vaccines some 10 years ago or even 20 years ago. It was to recognize. So they should be rest assured. Now, for the purpose of this exercise, we would also want to remind our cherished viewers and listeners to remember to pick their cards, the cards that were given to them when they went for the first dose, and also remember to pick a national ID card for the purpose of data identification and, of course, data entry. And so that is what I want to put across for now.
So long as you have taken your first dose, you can just walk to any of these facilities that are offering the second dose. Is that the case?
Not necessarily. It is for those who had the vaccine from the 10th to the 29th of March. They are the focus for this particular exercise.
Okay.
All right. Thank you very much, Dr. Achiano, for making time to speak with us. We also have the Bono East Director of Health, Dr. Fred Adomako Boateng, who has also joined us. So we have been following the situation in the Bono East region for a while, and we know that you're putting in so much to try and get people to comply with the protocols. So I first want to find out, how successful have you been? Is it reflecting your numbers?
Obviously. So if you look at good morning, Israel, and then good morning to my dear lady and all other cherished listeners. If you look at our figures, you remember when we had a discussion, the 31st week, we use weeks. We recorded 220 new cases. Then the 32nd week, we recorded 200 new cases. And then the 33rd week, we recorded 135 cases, new cases. And then just the past week, we recorded 145 new cases. And for me, if you ask me, I think the measures that we have put in place are actually yielding results. And if we continue as we have been doing, definitely, I think the numbers are going to come down. So far, I appreciate where we are now, and I believe that we can still do more.
Excellent. So how about the vaccine rollout as well? You were supposed to have gotten a consignment.
Yes, so we have gotten some. We are grateful to the minister, DJs, and then my good friend, Dr. Achiano. So we have been able to prioritize who should get it and where. You remember the last discussion that we had. If you look at the figures for Bono East, about 80% of all our cases are driven by only 4 districts. You know, Bono East, we are having 11 districts. But if you look at the epidemiology of what is happening, about 80% of all these cases are coming from only 4 districts. So the idea is if you're able to tackle these districts, obviously, you're able to bring down the spread. And then more importantly, even if you look at the districts where all these cases are coming from, for example, if you take Techima Municipal or Techima South, where almost we have a larger chunk of the cases coming from, they have 7 sub-districts making the Techima South. But if you look, 90% of all these cases is coming from only 1 sub-district.
Okay.
That is the Techima Central itself. So we believe that straight away, our job is well cut for us. We know where we have to spend our money. So we prioritize and make sure that, at least for what we have in mind, that we are going to ensure that we enforce the adherence to protocols. The security agencies, for that matter, are a priority because they are going to enforce that. And then if you also look at Nkranza South, it's also about 6 sub-districts. And thankfully, the driver is only in one of the sub-municipal, which is driving more than 80% of the new cases. So you see that our cases are well localized and loculated, so that if you're able to channel all our energies in these sub-municipal, we are sure that we'll be able to catch. So we have apportioned the vaccines that we have gotten along these lines, especially the Johnson & Johnson that we had. In fact, I will have to state that the amount that we had for the J&J will be able to take care of all the security agencies in the Bono East.
Well, that's excellent.
And then, secondly, we also look at the data and we...
Right, unfortunately, we have lost Dr. Fred Adomako Boateng, the Bono
We'll get him
East,
back.
Director of Health, but we'll try and get him back on the line so he can complete his submission. But it looks like they pretty have their job cut out for them. They have been able to identify the areas that they want to,
deal with. And then, but the thing about the Bono East region, though, is that they've kind of become like a blueprint for dealing with COVID-19, because they've really, they're very thorough. I mean, we've had this conversation about the past 3 weeks or so. They've been very thorough, very strategic, about dealing with the numbers and all of that. So good stuff. But he's back, Dr. Fred Adomako Boateng.
Yeah,
Okay,
Dr. Adomako
thank
Boateng,
you.
so you were making the point.
I'm in Kintampo. Our challenges. So, and when you come to the second dose, what we have done, and I think as the program manager said, we are going to give to basically all the health workers who got it. But if you remember, the first one that we got, apart from even the health workers, we were able to give some to the students, some to the traditional leaders. So what we are going to do for the second one that we have gotten is that, and based on, the risk we are going to make sure that about 90% of those who are going to receive the 80% of those who are going to receive the second dose those are health workers who are directly in contact with the cases. And you can see our numbers about, if you look at the proportion of cases that we have gotten, 30% of them are health workers. So it sounds natural that they receive it. So we are going to give to them second, because the AstraZeneca, I mean, you have to receive the second dose. And we are happy because we know them. So we are going to make sure that we stagger the way they come. In that way, we are going to avoid overcrowding, and then people also don't pick it. So second dose, we are going to give to those who receive the first dose, especially health workers, and notwithstanding the other things that we will get some extra and give it to the at-risk population, the 50 and above. So these are the measures that we have put in place. In fact, today I'm so happy that we are going to launch it at Kintampo. We are going to give it to the security agencies for the first dose at Kintampo at 10 o'clock. So I'm really excited that finally we have gotten the opportunity to give it to them and also to our health workers. So these are the measures that we have put in place. So we are really grateful to the national leadership and all others who are helping us to come to this place so far. Thank you.
Dr. Adumaku-Bating, how are you dealing with vaccine hesitancy, if there's anything like that in your region?
So the first one that we had, and this one, I just want us to discuss. People are where the health workers were, wait and see attitude.
Yeah.
But at the end of the day, more than 70% of our health workers received the vaccines. You know the theories that went around, but I have to admit to you, I've gotten my second dose. If I'm allowed, I'll even take the third dose. So now, but people really want to come, especially those who have already received the vaccines. The RCC, everybody is all calling. So we are not doing bad, but I think it can be better. But you can hear, people are now really wanting to receive the vaccine. The challenge is there anyway. You know the theories, the myths. I mean, you can never do away with that. But it's not bad so far. That is what I would say.
Now, I want to get this clear. Are you saying that there was some vaccine hesitancy amongst healthcare workers?
Obviously. I mean, we are all part of the community. And you see, we all have the challenges. All of us. So when it comes to beliefs, perceptions, Israel, it goes beyond this. And you see, this is the point that I have been discussing with a lot of people. People think that wear the mask, you just wear the mask. You need social scientists to really, anthropology to
And Kintampo does it again.
Right. Unfortunately, we seem to have lost Dr. Fred Adumaku-Bating. But thank you very much.
He's back.
Okay, so Dr.
Maybe finish up
Adumaku-Bating
with him. Yeah. It's gone again.
Okay. Too bad. The internet there isn't our best ally this
sketchy
morning. But thank you very much, Dr. Fred Adumaku-Bating. Let's go to the National COVID-19 dashboard and look at the cases as we have it now. So 630 new cases. We have 118,266 cases confirmed so far. Out of that, 110,225 people have recovered and have been discharged. The deaths have gone up to 1,017. And then we have active cases of 7,024. So, well, please, as we keep telling you, it is important that you comply with the protocols. The most important of them is keeping your mask on all the time. Immediately you step out and you're in public, please keep the mask on, as we have done here in the studio. So please stay safe. We're in very, very perilous times with COVID-19, especially the Delta variant on rampage. So please take good care of yourself.
Yes,
We're
please.
taking a break here on the AM show. When we come back, we'll be asking you what your highs and lows have been. It's we've done 8 months so far. I would want you to share your stories with us, and then we'll have showbiz as well. IB is already in the studio. Do stay tuned. We're back in a bit.